Hello, hello and welcome. Welcome to this ROS Facebook Live Bone Matters series. We're just going to hang on for a second and let a few people join, and then we'll be going forward. Okay, so hello. Welcome to Bone Matters. Today we're going to be talking about pregnancy associated osteoporosis. Now, many women get back pain in pregnancy, but very few go on to have this rare condition when bones break. But when it occurs, it can be very painful and disabling, and I think it's critical that people get the diagnosis and the care and maybe the treatment that they need. So I'm really pleased to welcome you to this session and to also welcome Stuart Ralston, who is a professor in rheumatology in Edinburgh, and really importantly to welcome Linda Stewart, who has experienced the condition herself. So I'm really delighted to have them both here today. Now we're going to be explaining what pregnancy associated osteoporosis is and discussing some of the common questions. So if you've got a question, then do post it. We may get to it, and if we don't, we'll certainly point you to other sources of information at the end of this session. So let's start out by finding out a bit more about the condition. Professor Ralston, can I ask you first to tell us really what is pregnancy-associated osteoporosis? How many women actually get it? And we just perhaps to add here that we're not talking about women who go into pregnancy knowing they've got a low bone density, but women who suddenly begin to get pain and problems around the time of giving birth. So tell us a bit more.
Okay, Sarah, thanks for the invitation. Yeah, pregnancy-associated osteoporosis, it's a form of osteoporosis as the name suggests, presents during pregnancy or just after, often with spine fractures. That's the most common. Although occasionally people can get hip fractures, but spine fractures are the most common. So from the patient's perspective, they present with back pain, and it's often missed initially because, as you said, back pain quite common during pregnancy. Pregnancy-associated osteoporosis rare, and my experience is there's a delay in it being diagnosed. But patients really can be quite severely affected with pain. They'll often lose height, and sometimes what I found out earlier today talking to Linda is that no one measures your height when you're at the start of pregnant, and no one measures your height at the end. And you think, oh, that would be a very easy thing to do, to flag up that, hey, wait a minute, this isn't ordinary back pain, there's something special about this. You asked how common it was. We really do not have much of an idea. It is said maybe one in, I don't know, various estimates, 500,000. From our own data in Lothian, we reckon, you're looking at the catchment area of Lothian where I work and the number of patients that attend the clinic, we think that there might be about maybe 1,000 patients, maybe 1,500 in the UK, but there are no good statistics on it. And it's not something that is coded in GP records. So, yeah, there's so much we don't know about it.
Yeah. And how is it actually diagnosed, and where would this happen? Would your GP be able to pick it up? I mean, what's the normal situation?
Yeah, I mean, usually, as I said, it often is quite severe back pain. It doesn't go away. Maybe, the back pain comes on either late during pregnancy or comes on often suddenly when the woman is breastfeeding. And the GP might be the first point of contact, but usually it will be diagnosed by an X-ray. So the GP will send the patient for an X-ray or maybe an MRI scan to pick up back pain, and then that's how it's diagnosed. And then after that, most commonly, a woman with pregnancy-associated osteoporosis would be referred to a specialist, a specialist in bone disease. So in Lothian, it would be me as a rheumatologist. In Glasgow, where I know Linda comes from, is the endocrinology doctors that see the condition. So that's the pathway I would have thought.
Right, and I know from what we hear that diagnosis can often be a real problem, and that's one of the real anxieties and concerns for women affected. And Linda, perhaps it's a good moment, tell us a little bit about your experience and maybe touching too on that whole sort of diagnosis problem. Tell us your story, we'd love to hear it.
Yeah, well, I developed back pain in my late pregnancy with my first child, and by the time I had given birth I was in extreme pain, couldn't walk, and I was admitted back into hospital due to like numbness, back pain and numbness in my leg, and they sent me for an MRI scan, I think mainly because of the numbness in my leg, and where the numbness was coming from was related to an area in my back, and they said I've got osteoporosis. At that point there was no mention of pregnancy associated osteoporosis. It was actually my husband that reminded me, that the woman actually said to me, have you been in an accident recently? And I always remember like looking at her like, no, definitely not. And she couldn't understand how I had osteoporosis, how I had these fractures, and I left the hospital like totally confused, and I just did a bit of research myself, because I thought, I've got osteoporosis and I'm so young, like how can this happen? And I basically researched myself and came across the Royal Osteoporosis Society website that had information about osteoporosis in relation to pregnancy. And I spoke to my GP, and he said, oh yeah, I think this is what you've got. And that was basically how I got diagnosed. And I was then sent for a DEXA scan that obviously showed osteoporosis in my spine, and osteopenia in the hips, and I wasn't given any treatment at that point. I did see an endocrinologist in East Ayrshire, which is where I stay, and he decided not to give me any medication. I think hoping that I wouldn't fracture anymore, but I continued to fracture, and I'd asked my doctor to be referred to.
A little bit of a sticking there. I think we've lost Linda for a minute. Are you there, Linda? Oh, she's disappeared. Let's hope she joins us in a moment. Good to hear her story, and I think one of the things that really struck me when we spoke earlier. Oh, you're back, Linda. I was just saying we lost you for a second, but that's okay.
Don't know what happened.
You're back, and I was just. It's really good to hear your story, and I wonder if you could tell us a little bit more about the impact it had on you, because I know when we spoke, we had a little chat to start with. You were saying that actually it's been really hard for you to even talk about it because it was so devastating at the time. I mean, obviously the pain was really quite dramatic for you.
Yeah. I mean, it was I think just being a new mum, not being able to look after your baby, that was the hardest thing for me. That I had not been able to just get up and lift your baby up. I mean, that was really hard. I would say that was the hardest thing. I think, not being able to walk and things like that, it was hard, but that was the hardest thing that and I think I get that from a lot of other women that I've spoken to that have had this. Not being able to look after their new baby is the one thing
that's a very hard time anyway, isn't it, without all that?
And
what was your kind of journey to recovery? I mean, how long did it take for you to get better?
Well, so I did eventually get treatment, teriparatide injections, which I took for 2 years, and they helped massively. And after I'd taken them, my bones had actually increased. My bone density had increased by 30% over that time, and the doctor had said that was quite a good amount. So kind of after then, it probably took me about 2 years, I would say, from when I got diagnosed to me starting to feel a bit better.
So the fractures took a couple of months or more to heal, but it took longer for you to begin to get back to normal activities.
Yeah. It probably took about 2 years before I started to feel kind of normal, like a new normal, not even normal what I was, but a new normal.
And you went... Sorry, carry on.
Sorry. No, it was just, you don't think that bones, they should just heal and everything be fine, but I think spinal fractures are a bit more complex, and they do take a lot longer than you realise to actually heal. I think the bones probably heal, but all the nerves and muscles and
absolutely, that can be a much longer process, and it's great to hear that. And in fact, the great news was that you went on to have another child, didn't you, without any problems? I know it's one of the questions I'm just going to ask Professor Ralston in a minute, but for you, that was a success, and it didn't happen again the second time.
So I had a boy a year ago, so he's just turned 1, and I'd had no problems with my bones at all. I got a DEXA scan about 6 months after I'd given birth, and my bone density had actually improved slightly from the last one.
So that's great news. And I think I was just going to ask Professor Ralston, this is something we get asked often, is it's happened once, is it going to happen again? I wondered if you could tell us a little bit more about that.
Yeah, well, like everything in pregnancy-associated osteoporosis, there's a lack of good information, but it has been said that maybe about 20% of women it can recur. So that's a 1 in 5 chance. So you can look at it either way. You can look at it, there's 1 in 5 chance to recur, or there's a 4 in 5 chance it won't recur. So it depends. It depends on whether you would want to have another baby. I've come across women who there's no way. I've got other women like Linda, they really want another baby. And sometimes doctors will offer treatment to try and reduce that risk. But we know it's caused by, whether the treatment is effective, but we know it's caused, we presume it's caused by bone loss during pregnancy, almost like excessive bone loss, because in everyone, you lose, all women lose a little bit of bone during pregnancy. But we think that maybe in people with pregnancy associated it's excessive, and there are drugs that can be given to prevent that bone loss, and so that's a strategy that's sometimes used. Although equally well, some women don't have additional treatment, and we don't know what is the best thing to do at the moment.
And that pattern of recovery in terms of getting better from the fractures and so on that Linda described, is that the kind of normal pattern? Because often it's very scary, isn't it, when this happens? You think, will I ever recover, and will I get back to my normal health? So is that very much the...
I think that's typical. I mean, you had, Linda, teriparatide, which is an osteoporosis treatment. That probably wasn't the reason your pain got better. Your pain probably got better because the fractures healed. And I think you're quite right. We're told that fractures heal within 6 to 8 weeks. But my experience is in women with vertebral fractures or spine fractures, not only pregnancy, but also other women with spine fractures, there can be a continued improvement for a number of months. And whether that's your back is getting used to the new shape of your back, because the back isn't what it was. No one really knows, but I think your story is typical, and at least improvement. You can say to women, well, you are going to improve. Your pain will improve, and hopefully that can give you some hope.
Yeah. And let's talk a little bit more about medications. I don't know if Linda, if you want to just ask a bit more about that.
Yeah. Just should everyone take a medication? What one would you recommend, and how long for? That given a medication to begin with, but then they decided to give me a medication.
Yeah, I think what triggered it in your case is that we know that pregnancy-associated osteoporosis, even if nothing happens, the bone density will increase, and often quite a lot, maybe 10% or more. And I've spoken to women who didn't want to take medication for one reason or another, except vitamin D maybe, and in them they've improved as well, and had often a very good increase in bone density. I think in your case, probably what triggered it is, even though the pregnancy, was over, you still had more fractures, and then I think as you did, many doctors then say, well, we better try something. Teriparatide is certainly not the most commonly used. I think a class of drugs called bisphosphonates, which we use in ordinary osteoporosis, if we can call it that. Things like alendronate or mesedronate, they can be used, or zoledronate or zoledronic acid, that's another one. And to know which is the best one, someone needs to do a clinical trial to find out. And of course, no one has done that, partly because it's a rare condition, but that's what we would need to know, what is the best thing for people to have. But that seems a way away at the moment. So at the moment, doctors are like really working in the dark somewhat, but I think the treatment you have, I've had a couple of cases in that treatment too, and like to think it's doing something.
And can I just ask about going on to have further babies having had some of these treatments? I know people worry a bit about certainly the drugs like bisphosphonates that sort of hang around in the bones quite a bit. Is it safe to go on and have another baby if you've had these treatments?
Well, if you look at the product information for bisphosphonates, so these are a class of drugs, it says they aren't recommended in women of childbearing potential. That's because there's a lack of information. But if you've had a bisphosphonate, once you stop it, okay, there is bisphosphonate in the bone, but the baby or the fetus is a very small chance that the fetus would get exposed to any bisphosphonate. Let's say you had zoledronic acid, then later you became pregnant. Very little exposure of the fetus. So I think, although we lack information, our feeling is drugs like bisphosphonates, as long as you stop them, would be safe if you then wanted to have a baby. Although medicines like teriparatide, you would not want to have a baby while you're on teriparatide. I would say it would be far too uncertain. But certainly bisphosphonates, as long as you stop them, I think that would be fine. And again, if you've had teriparatide and you stopped it again, I think everything should be okay as long as you're not on it at that time.
And another question we get asked about is breastfeeding. I don't know if that was one of the questions for you, Linda. I don't know.
Yeah. I didn't breastfeed, and I still fractured 9 vertebrae, and it was just to see, how does breastfeeding affect your bones?
Yeah, thanks, Linda. It is known that during pregnancy the bone density drops, like normally, by a little bit, and if you breastfeed, the lowest bone density is maintained for a bit. That's because if you're breastfeeding, obviously the milk contains calcium, and it's I guess coming out of the skeleton. Things you can do is take a diet that's rich in calcium and vitamin D to make sure you get enough calcium to give to the baby in the milk. I wouldn't say I wouldn't say don't breastfeed. We don't know if someone is going to be worse off by breastfeeding or not. If you are on medicine, though, like if you're on teriparatide or you're on a bisphosphonate, they may go into the milk, and I think there would be a caution there, basically. And I've spoken to women who didn't want to breastfeed if they were on treatment just because of that reason. But breastfeeding, it might not make things all that much worse, basically. So.
Okay. And what about a question about the future? I know I've got a question that's just come in actually about what does it mean for the future if you've had pregnant? Is that something that you think about, Linda, sometimes, about whether it means you're going to have osteoporosis later?
Yeah, it is. It's something that it does worry me. And about my children, like, well, obviously my daughter, who I had the osteoporosis with, like, would it affect her? Is there any sort of...
Well, again, we don't really know, and it's only in recent years we've kind of known about this thing of pregnancy-associated osteoporosis, so there hasn't been any research on, like, would your daughter be more susceptible. Regarding later in life, there are some women, and maybe you're one of them, where you seem to have recovered, like your bone density seems to have recovered. Although I am aware of other women with pregnancy osteoporosis who have had osteoporosis in later life, and it could be those are the women who maybe have low bone density or osteoporosis all of the time, like even before they became pregnant, and then it just got worse. And as Sarah knows, we're doing some research in this just to find out about the impact of women who've had pregnancy associated osteoporosis, even though maybe many years ago, do they still have osteoporosis? Do they still need treatment? And all of those questions are completely unknown at the moment, which seems incredible, but it's true.
And I guess the same about children. I guess it's just
Yeah.
you don't know, but I would imagine, Professor Ralston, that you don't see people whose mothers had pregnancy-associated osteoporosis who go on to have it themselves. I mean, I've not heard of that ever.
No,
So
I've not seen any with that. But so, yeah.
So just going back a bit, Linda, to what happened to you at the time, and obviously how worrying it is, and we've got lots of other information about pain management and so on, which we won't have time to cover here, but I just wondered what really helped you most at the time, looking back. Was it getting the information? Was there sort of practical support? What was most important?
Yeah, I think getting support was like the biggest major thing, through family, but also through the Royal Osteoporosis Society. I remember phoning the helpline, and they had put me in touch with a woman who had pregnancy osteoporosis, a woman called Sue Dudson, and I had been emailing her, and she put me in touch with the Facebook, a kind of Facebook support group, and that was a massive help. Just knowing, like, speaking to women that had been through it, you didn't feel so alone, so isolated, and just getting that support and understanding.
And that's the wonders of social media, isn't it, now, with a condition like this, which is so rare. This Facebook group is quite amazing. It's an international Facebook group, so wherever you are in the world, you can get in touch with other women, and there'll be details about that at the end of this if you want to know more. So, yeah, it's good that was there, and it's it's still very active, isn't it, supporting women?
Yeah, it is, and there's more and more women getting added to it all the time. So, yeah, it's been a great help.
Good. Let's think a bit more about causes, because I know that you just touched on that, Professor Ralston, but I mean, I'm sure many women want to know, why has this happened? Have we got any answers? Do we know what causes this? Is it, as you say, that women had low bone density anyway, or is it just a random happening?
Thanks. There is very little information. There are some women, I mean, usually what I should say, it comes out of the blue. And I don't know, it sounds like that's what happened to you, Linda, like completely, random. But there are some women who have developed pregnancy osteoporosis, and for one reason or another, they may have had a DEXA scan before pregnancy. So there are women that start off low and get worse. What proportion of that, we don't know. There have been very limited genetic studies showing that some women inherit let's say a gene abnormality that makes them have low bone density, so that may be a component. And then there are women who I have seen that maybe that have a complication of pregnancy. For example, I can think of one woman who had hyperemesis gravidarum, like she's vomiting. And then there are other women you see, and one of the drugs that's implicated are what's called blood thinning drugs. Okay, so there are some people who during pregnancy they have a tendency to form clots, and usually because of an inherited disorder, and those women need to go on to blood thinning agents. A medicine called heparin is the usual one, and that seems to predispose to osteoporosis too. So you get these little things coming together in isolated patients, but we don't have a picture of how often maybe there's a drug called heparin, or how often there's hyperemesis or some other complication. And that's one of the things that our survey, which I've briefly alluded to, is trying to find out.
Yeah, and I think that's really exciting from the Royal Osteoporosis Society point of view. Obviously, we're really pleased to be supporting what's going to be some really important research. I don't know, maybe if you could start off with talking a little bit about this survey that's going to underpin the research, and also what the research is setting out to do.
Sure. So the survey is something that can be filled in online by anyone, actually, across the world. And it just asks, how did it affect you? Was it back pain, whatever? Were you treated? Did you have complications of pregnancy? Did you have an underlying condition like, say, asthma or rheumatoid arthritis? So that gathers that information, and also information on how it affected your quality of life. and we're just, so this is all based on the patient's experience, as it were. And then if you complete that, there is the possibility to sign up to what's called our stage 2 of the research, which if people that sign up to stage 2, you have to give us your contact details, and then we will then be able to contact the consultant or the care team that looked after you during your pregnancy and get details of the bone density measurements that were done, what happened, more technical details. And there would be an opportunity to give us a blood sample, mainly for genetic analysis, and that could be taken perhaps by your GP or perhaps by the local hospital that you attend, and that's what it's all about. And the vision is to learn more about the causes of pregnancy-associated osteoporosis, so that we can maybe try and identify people at risk, and try and maybe look at what the most effective treatments were, and maybe design a trial. That's a much longer term aim, but that's what we're going for, really, to fill in the blanks that are present in this diagnosis that's so far, and it's long overdue, in my opinion.
I think that's really great. And someone's asking a question here saying, will the research help to improve all the difficulties we had with diagnosis and treatment? But I think what you're saying is, before you do the groundwork, you can't go on to do the because everyone would like to know, was there something missed? Could it have been picked up earlier? And as you said, we just don't know that yet. We need that information. So just to let everyone know who's watching, there is details below this session telling you how you can find that survey and find out more. Someone was asking about the find a friend part of the research. I don't know if you want to say a little bit more about that.
Thanks whoever asked that. I mean, whenever you ask someone, we're obviously asking women, did they have asthma, or did they have did they have any complications of pregnancy? And in order to interpret that, it's good to have someone who was maybe pregnant around the same time who didn't get pregnancy associated, just to compare. Because who knows, maybe you're more likely to get it if you had asthma, or if I don't know. No one knows that. And that's why we're asking for friends to also take part. It's very simple for them, but that would be great if we could get some friends. Even more than one friend per patient will do.
Great. And you've had quite a few people already answering the survey, which is quite exciting, considering its small numbers. Yeah.
It's amazing, and we've had a really good response. Although it's quick to do, survey's really quick, maybe depending on how much stuff you put in, but maybe 20 minutes. And I think even that is going to really advance knowledge quite a lot. So we're very excited by the study. Yeah,
that's great news. Really good. I'm glad to share it with everyone. So we're almost at the end now, but I guess I want to come back to you, Linda, really. First of all, I want to say, have you got any other questions for Professor Ralston right now? You've got your opportunity. Is there anything else you want to ask at all that's come to mind? Sorry, I don't mean to put you on the spot. You've probably got so many questions.
I know, I think I've kind of covered everything. Can't think of anything.
Well, perhaps I'm going to ask you another question. I don't want to put you on the spot. I mean, any particular message that you'd like to give out to other women who might be listening? I mean, is there anything that you'd like to say to them, perhaps?
Just stick in there. I mean, it's such a hard thing to deal with. I think when you, as you say, it's when you've just been given birth, and if it's your first, you're kind of all over the place anyway, and then to get told, to be in pain, to get told that you've got osteoporosis, it's a huge shock and a huge massive trauma. It's a real trauma, to be honest. And just seeking support is the main thing. I would say getting your doctor to refer you to a pain management clinic. That was one of the things that really helped me. And just getting as much support as you can from family and friends, and from the Royal Osteoporosis Society, the helpline and everything. Like, just seeking out support is the one thing that will help. Don't do it alone, because it's too hard.
No, that's really helpful, and thank you so much for sharing. And yeah, and I think I would just back that up too and say the help is there, it's out there if you need it, and we're here to help and support you. Make sure you've got the information you need as well to get so you can get the care and the treatment from the experts in the field. And so yeah, so we've got to finish now. Just real huge thanks, Professor Ralston, and to you, Linda, and to everyone out there who's listening. Join us for our next kind of Bone Matters part of the series. There'll be lots more to come, and if you've got any further questions or you're seeking information, just have a little look below this Facebook Live, and we'll point you in the right direction. So thank you, and see you again soon.
Bye all. Thank you.
Yep, thank you.
Bye bye.